I want to appreciate Dr. Chaze for that powerful submission. At Parliament last week, I said he is the first pastor I know who has ever prayed for a person, and after the prayer, he says, I have prayed, now go and say psychiatrist. The first pastor I know. And the person he referred is even in this house. And the person has recovered and has a story to tell. If you leave this house, please don't leave this house before you get that book, Breaking Free. By Angela, can you just wave to us as a living testimony?
Of mental disability. Was it a mental disability or it was just a simple thing?
What I can say, it was a disorder, the diagnosis that the doctor gave me. They told me it was bipolar affective disorder. Yes, that's what the doctor told me. I went through a season of taking medication for 5 years. I went through a season of also having to get counseling, a marriage counselor, and also a season of discovering who I am.
This is Angela Nsimbi, a team lead with Heart to Heart Mental Health Chat that supports people with mental health challenges. Angela is a survivor of bipolar disorder for a period of 5 years. She narrates that one of the signs that one is being affected by bipolar disorder is the extremism of someone's behavior.
Because me personally, I have watched a bipolar person on TV, and I have someone who has gone through bipolar process right here with me. Could you please tell us the signs?
One of the issues, I had challenges sleeping. Yes, then another, which the physical sign, which I could talk about, is rapid speech. And when I say rapid speech, I would wake up like 6 a.m. and talk from 6 a.m. to 6 p.m. non-stop. That is definitely not normal. Yes, my dear, when I'm talking. But talking about things which had hurt me, talking some things I don't remember, but most of it were issues that I had not dealt with. Husband took me to Pastor Chaze the first time, and I remember when he took me there, Pastor Chaze told him, because my husband was very upset when he was looking at he had taken our wedding album and showing Pastor that the woman I know is not like this, but see how she is. You know, he was also confused. He needed help.
This and many others have been affected by mental disorders. Worst of all, some take long to notice. While at the 3rd National Mental Health Conference 2024 that took place at Silver Springs Hotel for 3 days, different stakeholders have come up to fight against mental disability and to raise awareness to the public.
We considered as religious leaders, what is our position in this? I've realized most of you here do really go to church. But you will realize that if you don't have the right mindset, you may not even decipher things which are under your nose.
Addressing a mental health challenge of an individual, you have to take the approach of biopsychosocial model. Biopsychosocial meaning, if there's clinical presentation, the person is now severely disoriented from reality. They're unstable, they are removing clothes, they're harming themselves. There's already clinical presentation that is affecting their normal functioning.
In Uganda, out of 47 million people, 14 million are mentally sick, according to the report, and these have been attributed to a number of factors.
And one moment I met with, Professor Nachimori, and she told me, Pastor, you don't have to reinvent the wheel. The point is that when you do not know what is out there, you keep on starting what others have concluded.
The fight against mental health disorder involves a multi-sectoral approach that includes religious leaders. However, they face a number of challenges.
We are blamed that we hurt the patients. But by the time the patient comes to us, we do not have means to restrain them. The only way is try to lock them somewhere, bind them with ropes, and most of these are brought to our places and dropped there, and people go away. Go through all this, and still you have to speak to people on a daily basis, leave alone counseling sessions. Also the financial challenges which hit churches on a regular basis. Our pastors are too stretched. You listen to your friend and you compare what he used to say 10 years ago, and you feel like if only we had group therapy where someone would help us sit together as church leaders and discuss issues that we are going through and find help.
Bishop David Michael Chaze, the senior pastor from Omega Healing Center, ascertains that even though they have differences, there is need to work together.
If we are working with people, probably they would come in, help us dispense some medicine, and also work with us to help our patients through the challenges they are going through. We believe as COPE that churches, mosques are the biggest mental health centers where patients come in willingly.
Grace Obalim, a clinical psychologist from TPO Uganda, says mental health disorders differ from one at a time.
I first want to start by saying that when we are talking about mental health, healed health, like these mental health disorders, we need to know that it is presented in a continuum. Okay, in a continuum, meaning that the status changes at any time. Okay, right now I am mental okay. In the next 30 minutes, I can get a distressing news and I get stress.
Mental health not only arises in families but also places of work. In this, Golda Oboma from the Federation of Uganda Employers calls upon bosses to relate with others to avoid mental health issues.
The I don't care attitude, but it goes back to your leadership style. For us as the Federation of Uganda Employers and the partners of mental health here today, we are saying as a leader, be mental health survey, no issues about mental health. Let it start with you, be self-aware, then encourage your teams, be there at the forefront of the mental health campaign at the workplace. Then from there you're able to gain trust of your teams. Even when someone greets you and you do not answer, or you answer, let me tell you, staff feel it. Employees feel it. They know when your mood has changed. So it's very important for us as leaders, even before you get up with this I don't care attitude or the I am a boss, I'm a what, the staff works for you in a way, in one way or the other.
It's true that some Ugandans are mentally unstable, and this has been attributed to a number of factors, mostly poverty and gender-based violence. However, through prayer and being positive as we visit medical practitioners, we can end this cause. Naguja Serena, NSTV.